New tonight, time is running out for Congress to reauthorize federal funding for community health centers. A special trust fund was created to provide billions in grant money to community health centers around the nation. That funding will expire at the end of this week, but officials locally are hopeful lawmakers will take action before money runs out. Community health centers around the region are watching and waiting as the deadline to reauthorize federal funding for them fast approaches.
There's a special fund for community health centers nationwide, and Congress could reauthorize that at the end of the week, or they could choose not to reauthorize it, and that would be a problem for us.
Community health centers locally and around the country could lose as much as 70% of their federal grant funding.
For La Clinica, that means probably 6 to 10% of our budget, depending on how the cuts happen.
The impact could be even more significant at Rogue Community Health, where CEO William North says the loss in funding would be about 15% of the overall budget.
We would not hire additional medical providers as a result of the funding loss, and that would mean that we would not be able to take care of as many patients as we're currently taking care of.
Tens of thousands of Oregonians receive care between Medford's two community health center organizations. Whether it's in a clinic, at school, or on wheels, they provide medical and dental care to anyone who needs it, regardless of income or insurance. And while a bill has yet to make its way through Congress, officials are hopeful the funding will be reauthorized. It's just a matter of when.
We believe that it will occur, and we're just asking that it occur sooner than later because primarily we're interested in making sure that care to underserved populations does not get compromised.
If the funding is not reauthorized in the next few months, it will run out early next year. We reached out to Oregon lawmakers to see if funding will be secured by then. Representative Greg Walden says it is imperative that we finish our work quickly so that community health centers have certainty of funding and can plan for the future. I will continue to work to ensure they receive strong funding in a multi-year package that gives them the flexibility they need to continue helping patients in rural and underserved areas.
And Senator Ron Wyden says, quote, community health centers are among over 20 so-called health extenders that need to be addressed. I hope that Democrats and Republicans can work together and take action on these bipartisan priorities as quickly as possible. Meanwhile, we spoke with Oregon's junior Senator Jeff Merkley. He told us he believes the funding should be extended and thinks Congress could approve the funds quickly.
We're not doing anything right now on the floor of the Senate. We could have this whole bipartisan proposal on the floor of the Senate already. It's had thorough vetting in committee. The committee could have voted this morning. We could be on it right now because nothing is happening here. The Senate time is just being wasted.
We want to know what you'd like to see happen. Should Congress approve funds for community health centers? Like KOBI-TV NBC5 on Facebook and leave us a comment.